Hi, I'm Adrienne Loukopoulos, an occupational therapist here at Freedom Physical Therapy. Today I'm going to go over sleeping positions after having a shoulder injury or surgery. So Catherine here, we're going to pretend that her left side is injured for right now. So we're going to have her lay on her back. So now if you're feeling like your shoulder is falling back towards the bed and it's causing pain or tension on that injury, what you can do is take a small or thin pillow and slide it underneath that shoulder, just to give it some more support. Now you're going to take another pillow, and we want that arm nice and propped up, so it's not slipping and sliding off of the bed. So you're going to sleep just like that. Now the arm is nice in position and supported while she's sleeping. So I'm going to take these pillows away. Now we're going to switch and we're going to pretend that her right side is the injured side. So we're going to have her turn onto her side. I'm going to give her an extra pillow just to support her neck and make sure it's in good alignment. Now if you look here, her shoulder is falling in towards the bed. That's going to pinch and pull on that surgery site. So we want to make sure that she's nice and supported and get that shoulder back. So what we're going to do, we're going to put a pillow underneath her arm. Now her shoulder is in a better position. You can see it's not falling down in towards the bed. It's back and supported. If she were afraid or had a tendency to roll on her back while sleeping, what she could do is take an extra pillow, tuck it behind her back just to give her that tactile cue and remind her to stay on her side. This also helps her stay in better alignment and keep that shoulder nice and protected after her surgery.